Hey guys, sorry about that. The lovely internet demons, right? Or the gremlins, the Facebook Live gremlins, like I like to call them. Let me know if you guys can see me. I'm going to give you guys a few minutes to see that I'm hopping back on. Sometimes this happens. If you guys can see me, just type hi. And I'm going to give this lag time. Just want to make sure that I'm live again. Actually, let me check Facebook on my phone. Yay, I'm back. Okay, thank you, Tavia. Awesome. Well, somebody let me know what is the last part that you heard. What was the last part that you heard? Hi, Aisha. Oh, I'm so glad you're here. Thanks for hanging out, guys. Sorry about that. Max says hi. Great. Okay, good. You guys can hear me. You can see me. Beautiful. I'm not frozen anymore. Good. Yay. Okay. So when that happens, we just got to roll with it, right? It happens. Happens to all of us. Okay. What was the last piece that you guys remember hearing? Can somebody just type in the chat what it was? What was the last piece before? Why no kickbacks? Okay, was that the last piece? Why no kickbacks? Okay, so why no kickbacks? Hey, no stopping Chris is sharing. You just got to keep going. There's always a way, guys. It's always, as for those of you that follow Marie Forleo, I love her statement, everything is figure outable, right? We just get to go. Okay, so Tavia was talking about why no kickbacks? Or I was talking about it and Tavia was reminding me. Awesome. So I hope I answered your question about the no kickbacks. The story that I was in the middle of telling you guys was actually about a client that came to me. Okay, and she came to me from a chiropractor who was one of my referral partners. And she said, Chris, I went to my doctor. He is a neuro surgeon. Thank you, Stephanie. And he said, I need to lose 15 pounds. And I asked him, how do I lose that 15 pounds? And he was like, well, I don't know, just go find a program. He had no resource. So, number one, I want to point out that he had no resource. So he just told her, I don't know, find a program, lose the 15 pounds. I can't do surgery on your back until you do. She went to her chiropractor because she had been seeing the chiropractor. Of course, she's injured with her back. And he said, go call Chris. He was one of my referral partners. He was also one that actually sat into a couple of my classes. And he was the very first person that I reached out to around filling this gap. So she called me and actually took her through the 6-week wellness program in a one-on-one capacity. Now, I took people through one-on-one as well as in groups. But this particular client, I didn't have a group going at the time that she was reaching out to me. And so I took her through the program one-on-one. She went back to her doctor. She lost the weight. And her doctor was like, oh my God, how did you do this? Who are you working with? I want her card. So she gave him my business card, and his nurse contacted me and said, Chris, can we please have some flyers? Would you mind coming in and talking with us? And I'm like, absolutely. So that doctor's office began sharing my flyers and began referring their patients to me because they saw the value and they didn't have a resource. So again, I had one patient coming to me. She went back to her doctor. Can you see how all of this is intimately connected? Can you see how, first of all, personal connections are really important? And then when you help a client, they go back to their doctor, and that actually builds a relationship there. Does that make sense how this all works? It doesn't have to be any harder than this. It really, really doesn't. It can be simple. And by the way, you don't need 20, 30, 50 referral partners. I had five main referral partners. I had my chiropractor, I had my acupuncturist, I had the digestive health associates, I had the holistic nurse, and I had an integrative doctor. 5. As a matter of fact, the integrative doctor put his whole staff through my program, his practice manager, his massage therapist, as well as a couple other nurses that went through the program as well. And from there, they had the benefits, they saw the results, and they also referred patients. And actually, they were the ones that asked if I could come to their lobby, teach it there, and they would actually print all the materials off. Pretty amazing. So, connections, personal connection, start locally, start with who you know, create a relationship. That is the foundation. Those are the first two steps that we need to be working with in creating those connections with people that we want to collaborate with. Now, I said I would open this up for some questions, and I meant that. So tell me, what are some questions that you guys have around what we're talking about here with starting locally, starting personally, as well as building and developing relationships? Just type them in the chat, and I will answer any questions that you guys have. So let me know, what are some of the things that you guys are struggling with or you want your questions answered around collaborating with doctors as well as holistic health practitioners? It doesn't have to just be doctors. It doesn't just have to be chiropractors. It can also be massage therapists. It can also be other practitioners that serve your ideal client just in a different way. Just in a different way. So, for example, if you're a health coach, maybe you are actually collaborating with somebody who wants to share about their essential oils, right? So they might serve women who are dealing with stress or digestive issues or what else? Stephanie, you need to help me out with this one because you're the essential oils lady. But it works really, really well. Works really, really well when you are collaborating with people who serve your same client just in a different way. Just in a different way. Any questions? Just type them in the chat and I will absolutely answer your questions. Should we make an appointment for treatment? Okay, so when you're going to see your doctor, should you, okay, great. Yes, should you make an appointment for treatment? So it depends on how well you know them. For me, with my chiropractor, my acupuncturist, I knew them and I just asked them if we could just go out to lunch, that I had this thing that I wanted to share with them. I wanted to get their eyes on it. I wanted to get their feedback on it and see if it is something that we might be able to collaborate with. And I used that word collaborate because they knew that, I mean, again, we were friends. We had a connection there. We weren't best friends, but they were my chiropractor. And when I called them and said, hey, I'm a health coach, I'm a nutritional therapy practitioner, I've created this resource that I think would really be beneficial to you. Could we meet for lunch and I could show it to you? I actually did also pick up a phone and call a naturopath who I didn't have a connection with, but I said, hey, I'm a health coach. We both live in the same area. I was wondering if you might want to meet for coffee and we could talk about how we might be able to serve your patients and my clients better. Because I have some people that I would like to refer to a naturopath, and I'd like to know who you serve as well. Well, of course she wants to collaborate. And so we met for coffee and we had a conversation. So it depends. I know, right? Like there's no black and white answer for that. How well do you know them? If you know them enough where you could say, hey, Dr. So-and-so, I've got this program, I've got this resource that I think would really benefit your patients. Could I share it with you? That's the way that you want to present it. I have this resource that I really think that would benefit your patients. I'd like to have coffee with you and share it with you and get your thoughts. So Stephanie says the essential oils help with stress, sleep, pain, and digestive issues. Awesome. Any other questions? Any other questions that are popping up for you? So I'm going to give you an action step for today. And what I want you to do is to make a list of the doctors, nurses, chiropractors, any holistic health practitioner, and even any other coaches that you know that you could connect with and share information because you serve the same client just in a different way. Aisha, do we have to have an online training program for them to take? Well, let me see. So you do need to have a resource, yes. And we're going to talk about resources next week and the week after. So yes, you do want to have a resource because here's why. If you don't have a resource, then what you're doing is you're asking a doctor or you're asking somebody to just refer you just because you're a health coach. But they don't really know what it is that you do. It makes a big difference. You need to have a resource. Thank you, Tavia. Yes. So if you don't have an online training program, that's okay, but you need to have a resource for them. You need to have something that you can talk about that is helping their patients create value. For me, it was actually I started in person. So I did it in person. It wasn't an online training program. It was an in-person 6-week wellness program. And then I started doing it online just using Zoom. So it doesn't have to be a online training program where you've got a website built out and you've got this whole modules and you're in Thinkific or Kajabi or Teachable. It doesn't have to be that complicated. I didn't use it in that way at all. As a matter of fact, I had my weeks out. I had a 6-week wellness program and I delivered them in a PDF form via email. And then we jumped on live for Zoom. So I actually did in person and I also did it online. Does that make sense, Aisha? Does that answer your question? Yeah, so you don't have to have an online training program, but you do want to have a resource because you want to talk about the resource and how the resource is going to benefit their patients. That's what they want to know. So instead of trying to sell you, you get to talk about the program. Yes, great, awesome. Tavia talks to them about, she's got a 6-week fast track and also a 12-week. Beautiful. Tavia, I wish I could bring you on here to talk about that because I know that that is something that you've had a lot of success with. Any other questions? Any other questions? Tavia says, yeah, that you can also, okay, so Aisha, you can tell them that you have a 6-week fast track as well as a 12-week. So here's the thing, guys, though, you want to say more than just you have a program. You want to actually share what is the value and what is the benefit that their patient is going to get. So that's super, super important. You want to be really clear on that. Be really, really clear about if you have a 12-week program, what are the benefits that one of their patients is going to get? And how is it going to take the burden off their shoulders so that you can actually help their patients? Awesome. Any other questions? Any other questions? These are great questions, by the way, you guys. Thank you so much for being here. Thank you for interacting. Thank you for asking your questions. I know there's a lag, so let me just give you all a few more minutes. Awesome. Okay, so your action step for day one is make a list of who it is that you know. Also, I want to invite you to research online, and you can actually do this inside of Facebook. Are there any small business networking opportunities available in your area? I know my small business networking, okay, great, Tavia. I know my community has a small business networking group that meets online. They meet in Zoom. Yes, Tavia, what's your question? I would love to answer your question. Totally, Stephanie, that'd be great. Absolutely. So we can't do coffee, our shops are closed. How do you propose networking otherwise? Hop on Zoom, maybe invite to a call. Yes, I would actually invite them to a Zoom call over a telephone call so that you can actually connect more personally, so that you can see them, they can see you, and there's just more of a connection. So yeah, right, we can't do coffee, our shops are closed, so how do you do that? Yeah, you would absolutely reach out and say, hey, I would love to just have a quick chat with you, 15 minutes and share. First of all, again, you don't want to say, hey, I want to share my thing with you. You want to see, could we connect so that I could hear more about your practice so that I know who to refer to you? And then you can say, and I have a resource that I think would really benefit your patients. So always start from how it is that they, again, and I know I've said this over today, but people are always thinking, what's in it for me, right? We're always thinking, oh, what's in it for me? Like, what's in it for me if I do this thing? So go ahead and just say, hey, like, I want to learn more about you so that I can refer clients to you. I want to learn more about you and your business so that when I come across somebody that I think would be a really good fit, I can send them your way. Start off the conversation that way. And then you can say, and I would love to share a specific resource, a program, an offer, whatever it is that you have, and see if it might be a good fit for your patients. See if it might fill in a gap between what you're providing for your patients or your clients right now and how I can serve them. Sherry says, yes, my networking groups are doing Zoom and they're having lots of one-on-one calls. They're great. Whoops, just lost the comment. Great with referrals to learn about them. Fantastic. Vicki said, I just connected with a provider a couple weeks ago for Hike. Oh my God, how cool. We were acquaintances and knew we wanted to collaborate and just get to know each other. Hiking was casual and we got tons of divine downloads. Oh my goodness, Vicki, I love that. I love that. So let's take the complication out. Let's take the fear out. Let's just let it be simple. You just get to be a real person. You just get to make connections. So think about it, instead of you trying to sell yourself, think about this as an opportunity to just create connections. How can you help each other? Just connect to connect. You don't need to be a salesy weirdo. We just get to connect. Awesome. Thank you, Vicki. Tavia says, my chiropractor sends a lot of people to her. The doctors are not as great. I think they're busy. Yes, doctors absolutely are busy. Absolutely. They are, for sure. Yeah. And you know what? It's going to be different for each one of you, depending on the relationship that you have, right? Like, and isn't that the same for all of us? When we have a relationship with somebody, the chiropractors absolutely can, if we've got a certain type of relationship, then they're going to refer. But again, I want you to hear me say I only really had 5. And I built a very thriving 6-figure health coaching practice by doing that. The other thing that I want you to remember is that when you work with somebody, when you are actually bringing clients on and you're taking them through a specific resource, 30% of those people are going to continue to work with you in some way, shape, or form. And we're going to talk about that tomorrow and how you are actually able, what the numbers look like. So we'll get into numbers and nitty gritty tomorrow evening. Awesome. Yay. Cool. All right. If you have no more questions, I'm going to open it up one last time. Any other questions? How can I serve you? What questions do you need to have answered? I'm happy to help. I'm happy to share. All right. If you are watching the replay and you have a question, type in #replay because I'm going to be looking for that and looking for those questions. The other thing that if you could do is tag me in your question so I won't miss it. Please tag me in your question. So even those of you that are here live, if you have a question that pops up later, come back in and tag me in your question. Tavia says, I have a chiro, acupuncturist, and massage on my referral team. They're all great. Absolutely. Fantastic. I love that. You're welcome, Vicki. Oh, I'm so glad it was helpful. All right, my dears. I hope you have an amazing evening. You're welcome, Tavia. So good to have you here. I love you. I'm going to go have dinner with my husband, and I will absolutely come back in here and answer any questions that you have. Stephanie says that simplified the process, far less scary. Yeah, it just gets to be more simple, my friends. You're welcome, Aisha. Thank you for being here. I'm so glad. All right, ladies, have a great evening. I will see you back here tomorrow night at 6 o'clock. We'll dive into step 3 and step 4. And if you have any questions in between then, tag me and I'll answer them. You're welcome, Valeria. Otherwise, I will see you tomorrow night. Bye.